Avidin is a protein most commonly found in the egg whites of avian, reptile, and amphibian eggs, though it is commercially extracted primarily from chicken eggs. It is a tetrameric protein composed of 4 identical subunits, each forming an 8-stranded antiparallel beta barrel. Avidin has the strongest known non-covalent binding affinity for its ligand, biotin, with a dissociation constant of 10 to the minus 15th molar. Avidin can bind 4 molecules of biotin, 1 at each subunit. Biotin, also known as vitamin B7, is a cofactor required for many carboxylation reactions in the body and plays an important role in the citric acid cycle, gluconeogenesis, and fatty acid synthesis. The biotin binding pocket is buried deep in the core of each beta barrel. It is surrounded by both hydrophobic and polar residues. As seen in this view of 2 molecules of biotin bound to 2 subunits of avidin, it forms 9 hydrogen bonds with alanine, threonine, serine, tyrosine, and asparagine residues. It also forms important hydrophobic interactions with a valine and phenylalanine residue, but most importantly with 2 tryptophan residues, one of which partially closes off the binding pocket, increasing the protein's affinity for biotin. The high affinity of avidin for biotin has been exploited in many important laboratory tests, including detection and protein purification of biotinylated molecules, nucleic acid detection, and tests used in medicine every day, including the famous ELISA, or enzyme-linked immunosorbent assay. First, the sample of unknown antigen is immobilized in a well or on a plate. Next, a primary antibody against the antigen to be tested for is added. Then, a secondary antibody that has been biotinylated at one end binds to the primary antibody. Finally, an enzyme-bound avidin complex is added to the well, which binds strongly to the biotinylated secondary antibody. After washing, a substrate whose reaction is catalyzed by the enzyme and leads to a color change in solution is added. If the desired antigen is present, this end reaction and subsequent color change will occur and the test will be positive. Another successful use of avidin has been in drug safety. The drug idraperonux is a powerful anticoagulant, similar to heparin, but with longer-lasting effects due to a much longer half-life. Treatment with idraperonux only requires weekly injections, as opposed to daily. It works by binding to and amplifying the effects of antithrombin, a protein that acts as a naturally occurring blood thinner by inhibiting factor Xa in the clotting cascade, thereby halting the progress of the cascade and preventing clots from forming. However, due to its potency, idraperonux caused many deaths due to the inability to control its activity and increased risk of bleeding. The drug was then altered to add a molecule of biotin to the non-reducing end, so that a simple intravenous infusion of avidin would halt its activity in the case of excessive bleeding by binding the biotinylated end of the drug and altering its effectiveness. This was proven successful in clinical trials, with idrabiotiperonux resulting in far fewer bleeding events than idraperonux. One possible use of the avidin biotin binding system currently being investigated is tissue engineering for skin grafts. This involves forming a scaffold to mimic the extracellular matrix and then spreading adipose-derived stem cells over the scaffold to grow a sample of skin to use as graft. In 2015, one promising study found that adding avidin biotin binding technology to the scaffold significantly promoted attachment and growth of the stem cells. The features of this resilient protein are incredibly unique and powerful. Avidin will provide scientists with endless possibilities of future applications for years to come.